A 64-year-old female comes in with swelling in her cheek. Check out the full case today on the open reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolten, and today we're reviewing how to drain a simple dental abscess. This patient is a 64-year-old female who was referred for treatment of a swollen cheek. She recently developed severe pain with a tooth in her left lower jaw, tooth number 18. 2 days ago, she noticed swelling in her left cheek, and it's since become worse. She is afebrile, has no difficulty breathing, and no difficulty swallowing. Her floor of mouth is soft, and her uvula is not deviated. I reviewed the Panorex provided, and immediately it's obvious what the problem is. There is a large radiolucency at the base of this tooth, meaning there's a chronic infectious process. The chronic infection finally broke through her mandible and is now causing swelling in the soft tissue of the cheek. I can visualize the swelling in the buccal vestibule, and it is fluctuant. This is a textbook vestibular abscess, something that can be treated in the office. Antibiotics alone are not enough to solve this problem because there is an abscess. The only treatment is an incision and drainage. This can be done under local anesthesia, although it can be very hard to anesthetize an area with an active infection. The first step is to administer an inferior alveolar nerve block and then give local infiltration as well. I start superficially with the local and then eventually enter the abscess cavity. I allow plenty of time for the local to work. Next, I create an incision in the area of greatest fluctuance. The only anatomic obstacle we really need to be worried about in this area is the mental foramen and nerve. Thankfully, this abscess is posterior to the nerve location, so I know I'm safe making an incision here. I incise over the abscess and begin to express a lot of purulence. Next, I use a hemostat to bluntly dissect around the abscess cavity. I can feel I am on bone, and I want to explore everywhere to make sure I don't leave any loculations behind. Next, I irrigate this cavity very thoroughly with normal saline. Finally, I pack the site with iodoform dressing and secure the dressing with sutures. The dressing is placed to fill the void where the abscess cavity is so that there is no dead space. The dressing is also used to maintain patency of the abscess cavity so that it does not close prematurely and cause reaccumulation of the infection. I placed the patient on antibiotics and then saw her back 4 days later to remove the packing. I soon after had her back to extract the tooth. I know some people are going to ask, why didn't I just extract the tooth when I drained the abscess? The answer is, It's extremely difficult to get an area like this completely anesthetized with an active infection. It's possible to do this under sedation, but this was an emergency case and she was an NPO. The best course of action is to address the acute infection by the incision and drainage, then placing the patient on antibiotics, then seeing her back to remove the tooth. Thanks so much for watching. Please click those like and subscribe buttons and check out my channel for other interesting OMFS cases. Also, check out my website, theopenreduction.com, where I will be posting advanced content to help you hone your surgical skills. I'm Dr. Tom Bolten. I'll catch you next time on the Open Reduction.